It's so good to be live for another challenge event. Hey, everybody, it's Frank Dole from Arsenal. I hope you're doing fantastic. Welcome to the 3-day BioPharma Job Challenge. We go live, and you know that there's always going to be something interesting that comes up. It would be a lot easier not to do this at all, but then it's like, okay, well, maybe we should just record these and not do them live, but then we miss out on the interactions. But thank you for being so gracious with your time. I am excited about what we've got to accomplish today. Okay, so here we go. We're going to talk about in the next 3 days from 12 to about 12:30 Eastern, Wednesday, Thursday, Friday of this week, September. September is a critical month. We're going to go through our job challenge. So that means we're going to talk about what's going on in the market when it comes to biopharma jobs, how to handle it. We're going to talk about some advanced tools. I'm going to give you some resources, some goodies. I'm even going to incentivize you to engage and to be here live each day. Now, if you can't hear the logistics, if you're tuning in from TikTok, Instagram, YouTube, LinkedIn, welcome. But you'll see the ticker below, 3day.medicinemarket.com. Go there. You're 2 clicks and 20 seconds away from getting the resources and all the goodies that come with it. And there's some surprises that will also drop on Friday, which are fun, but you're not going to get them from the other streaming platforms. Today's the only day we're going to stream to LinkedIn, TikTok, blah, 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 blah. Okay, so let's get ready. Let's get moving. We got a lot to do in a short period of time. Okay, so click on that. Action number 1, 3-day. .medicinemarket.com. Second, let's engage with each other. If you're on our platform, fantastic. You've got questions, you've got polls. If you're on the other social platforms, where are you tuning in from? Drop it in the chat. I want to be able to see where everybody is joining us from. So now that we've talked about some fun stuff, one of the important things that we want to cover, okay, over the next few days are trying to give you insider tips and tricks to get you the outcome that you want. Whether you're someone seeking a better job, a new job, your first time in biotech and pharma job, if you're coaching and mentoring other people, how do we give you the insider tips and tricks? That's what we're going to deliver here over the next few days. And I feel that we're uniquely positioned to do that. Why? Not going to go deep into my background. I'm sure that you already know who I am. You can take a look at my LinkedIn profile. First 21 years of my career, 7 different biotech/pharma companies. Last 7 years, I live to find ways to bring opportunity to good people who want to contribute to this industry and help companies actually create a culture of innovation so they can create breakthroughs for patients. This is an incredible industry. It is one that has so much purpose and calling for so many of us. And let's face it, if you've been in biotech or pharma for a period of time, you already know the amount of time that you spend commuting, traveling, going to conferences, working, going through meetings, producing the reports. It doesn't always add up. But when you feel like you're a part of something bigger than yourself, an industry dedicated to improving and extending patients' lives, there's something very noble about that. It makes the path worthwhile. But the market is in an interesting spot. That is for sure right now. Let's talk about that. And when you think about your career in biopharma, and by the way, when I say biopharma, I'm talking about the biotech industry and the pharmaceutical industry, and yes, that unique layer that's called biopharma, but we're going to talk about the umbrella. For speed and efficiency, let's agree to that. We're going to call it biopharma. When you hit the director level and then higher, after you talk about the people, every meeting is going to start with some numbers. So let's talk about some numbers. What's going on in the industry? First of all, for context, this is a $3 trillion a year industry. Biotech, pharma, biopharma, that alone, $3 trillion industry. And I'm not talking about the ancillary industry. So for companies that do clinical trial data and recruitment, but they're labeling themselves on LinkedIn as biotech, no. You're biotech adjacent. We're talking about biotech and pharma right now, $3 trillion industry. An incredible living, breathing financial organism that means so much to so many people, produces incredible innovations, but also has a lot of risk and challenges that are associated with it. But that being said, In the United States alone, how many employees are in biotech and pharma/biopharma? How many? Put it in the chat. Guess. In the US, how many employees? Okay, I'm going to tell you. It's 412,000 in the United States. That's not even counting globally. This is a big, big industry in the US alone. But what's happening with the industry? Let's think about that. In 2025, there have been over 14,000 jobs that have disappeared so far this year. 14,000, and those are the only ones that we can count. Why is that important? Because if you've been in this industry for more than 5 minutes, you know when you're shaving down in a department, you're reducing the sales force a little bit, you're cutting a few positions in the home office, even if you're publicly traded, depending on the size of the down cut, if you will, excuse me, you don't always have to report it. So unless it hits a press release, and let's face it, as a leader in biotech, I don't want to do a press release every time we have to cut some people. So unless it's required, we don't always announce it. But what's been announced, 14,000 jobs, goodbye. There is a 31% surge in layoffs so far this year, year over year. Last year was a tough year, but this year is really, really tough. In fact, there are analysts out there, the high-paid consultants that are really talented at what they do. They're saying that we are in this extinction phase for some biotech and pharmaceutical companies that are out there. Why? Well, right now, when you consider the market, 40% of biotech and pharma companies that are publicly traded are at risk of running out of money. So you've got an incredible uncertain market. You've got macroeconomic issues that are going on. There are social and political issues that are putting stress on the industry. So if you are someone who is looking for a job, looking for a different job, looking for a better job, and you're feeling that there are delays, you are feeling that there's a gap in communication, you feel like there's an element of competition that you don't even begin to understand, that's totally okay. You're feeling the pressure coming back from the market. As we push on it, it's bouncing back with the pressures that exist inside these organizations. So when you think about that, let me ask you a question that you can go ahead and put in the chat. When you think about your network, and this is a very social industry, whether you're working in the lab, whether you're working in the field, it's a very social industry. We have a lot of educated people. We have people that go to a lot of conferences. We have folks that network quite a bit. If you know more than 2 people right now that are looking for a biopharma job, whether they're employed or not, in your network, can you think of, are there more than 2 people? Put a yes in the chat. I want to see how many people are acknowledging that. I think that there's a lot of us that have a network of people that are reaching out to us and say, hey, can you do me a favor? I want you to look at my resume, and I want you to share it with your network if job opportunities come up. How many times have you received that phone call? How many times have you received that message? I know that I receive it all the time. You're very busy. Having the job of being someone else's personal recruiter is a difficult one, but they want you to think about them when you're not talking with them and bring them opportunity. One way you can be the hero is to share with them the 3day.medicinethemarket.com website so they can get access to the resources and the replays, and this may be able to help them. Let's face it, how many times have you sent their resume to someone when you found a job that would match up? Unless they're your best friend or a family member, probably not. So be the hero. Share with them the 3-day BioPharma Job Challenge. Okay, so that being said, let's talk about the process and what's really interesting. And we're going to talk about tools, advanced tools tomorrow, and additional resources to help you on day 3. So we've got a lot to cover over these next 3 days, but let's map out the process so we know what we're dealing with. So our internal systems, our internal process, our way of managing this can be fun, easy, and productive. But we need to know what we're dealing with first. So let's talk about that. Being on the side of talking about innovation and best practices with pharma today versus the first majority of my career, the first 20 plus years of my career inside pharma companies and biotech. Here are some things that we just can't tell you about, but I can share with you now. When you consider a market like we're in today, You have the biopharma industry, very desirable. Like I said before, a higher calling, a bigger mission. It feels good to be a part of this. Second, it pays well. It pays really, really well. If you think about the compensation associated with these roles, if you were doing marketing in another industry, if you were doing research in another industry, and you came over to biotech or pharma, while there's lots of pressure on lots of companies, and certainly there are several publicly traded biotechs and pharmas right now on the stock market that are trading for 30, 40, 80, 90% lower than their value just a few years ago. Because of the equity often involved in many of these roles, there are certainly incredible paydays. Think Intercellular, think Biohaven. There are some unbelievable breakthroughs financially when a company really has a big hit. So it attracts a lot of people. It attracts people from academia who want to take their incredible undergraduate and graduate degrees and come into pharma. People want to move from other sales roles into biopharma sales roles. But with the contraction in the market, you've got more talented people with industry experience than there are jobs. Well, that's a friction point. And if you're one of those people, I can imagine that doesn't feel fantastic. You are competing for so many other talented people that also have experience. But don't forget, we also have all of these other very qualified entities that don't have direct biotech and pharma experience that want it, that want those jobs. What's the result? You are getting hundreds of applicants per role. Let me give you a specific example. Several years ago, I was part of building out a charter sales force. We had 133 positions in the field. These are great paying jobs, six-figure jobs, company cars, benefits, equity, the whole thing. We had over 15,000 qualified applicants. 133 jobs, 15,000 qualified applicants. What does that mean? Because it's going on today as well. It means that what no one will tell you is that the current system is built for elimination. Let's just say the first 80, 90% of the recruiting and interview process is built for elimination, not necessarily finding the right person. So what do you have to do when you've got great decorated career elements, when you have an incredible education, when you've got a track record of success, when you've got a very good network, and you're not getting the responses back from the market that you want? We have to think about this from the point of view of, this is a process that's based on elimination, not finding the best person. We'll find the best person once we bring the pool down and we do the final parts of the interview. So I want you to think about, how will we use advanced tools to be able to find the great jobs, compete for them in a more effective way, use strategies and techniques and tactics to help us break through and really emerge well, and then hopefully be in the position of what I like to say, of the yeses and the nos. If you own the yeses and the nos, that means you're getting the offer and you can choose to take it or leave it. When we don't have control of the yeses and the nos, someone else, whether it's an applicant tracking system, a hiring manager, an ancillary decision maker, is controlling our fate. I want to put you in the position to control the yeses and the nos. And that's what we're going to walk through over the next few days. So we know that it's a highly valuable, high stakes market. We've been interested in it for a while. We've perhaps been in it for a while. We want to take it further. We know that the industry is contracting. We know that competition is high. And we also know that technology and the overall process is based on elimination versus helping us to genuinely stand out. So what do? Well, we've got to find a way to manage this system in a fun, easy, and productive way to go ahead and move forward. And one of the first things I want to start to talk to you about is things you can use to help find these jobs. Okay, so let's start with that. I want to talk about, and let me share my screen with you here. Okay, so let's talk about tools to find jobs. Okay. So if you go to medicinemarket.com, if you go to our jobs page, it's also jobs@medicinemarket.com. We've got a bunch of jobs that are curated here, and we're trying to track ones that are worth going after. So if you want to go ahead and take a look at that, please do. Here's why we built jobs.medicinemarket.com. Of the 2,000 companies in biotech and pharma that do business in the United States and the EU, for example, I think there's probably 200 that are really worth watching. Why? Well, there's a million reasons why I would not pay as close attention to some of the others outside that top 200. But one of the easy ones that we mentioned earlier is that 40% of these companies are at risk of running out of money. Many of these companies don't have a super interesting pipeline. Many of these companies have some cultural issues, that are going on that are not that interesting. So the bigger point here is that you want to shortlist these companies. But if you're looking for a job in biotech or pharma, there's typically 3 ways that they're going to come forward. The first way and the best way is that your network comes to you and says, hey, Frank, I think that you're really good at what you do. We need someone really good at doing this. Would you like to compete for this job? I'll connect you with the hiring manager. That's the best way. What's the second way? The second way is to get a call, to get an in-mail, to get an email, to get a message from like a recruiter. And the recruiters are amazing. They've got a set number of clients and they're representing them and they're incented to try to get a placement for that job. The challenge is that if you're looking at the industry through the window of a recruiter, you're only going to see their 5 clients. You're not going to see all the opportunities that are out there, which leads us to the third path. And the third path is going down the job boards, Indeed, LinkedIn, and others. And what happens? Well, you probably already know what happens is you have to scroll through 10 pages to find 3 jobs that actually meet your sophisticated search criteria, because many companies are calling themselves biotechs that shouldn't. Many positions are trying to pay to be promoted and have someone talented like you see it instead of concentrating on your job search. It's just a highly inefficient and not so fun process. That's why we created jobs.medicinemarket.com. We've decided that we've picked many companies beyond the 200 that I referenced earlier, but we're tracking the positions that they have open and we're putting them on the site. So it's more of a curated list. It's more of a pure play biotech and pharma. So I encourage you to go ahead and use that. Currently, it's free to go ahead and use. We are considering putting it behind a paywall because it creates that much value and efficiency for people. But for attending this, I'll make sure that you can continue to have access to that, moving forward. But take a look at it right now. Go ahead and use it. We don't have any connection to these companies. We're not being incentivized to push them on anybody. You apply directly on the company's website. We don't handle resumes, none of that. We're just trying to connect people to great opportunities. So go ahead and use that. So if you find that really cool job, what I want you to then do is I want you to take a look at your situation and what that job wants. So an example of doing something like that would be to go and find a job. So let's pretend we're looking at this vice president commercial assessment job in Medicine to Market. Okay, I'm gonna take the job description. It looks interesting. I'm gonna go ahead and copy that. And what I'm then gonna do is I'm gonna try to take a look and see if I can have technology help me, almost like an assistant that doesn't cost what I cost, to help me assess this particular company, the job, and potentially my fit. So if you go to jobsai.medicinemarket.com, and by the way, when you go there, what I want you to do as a part of the 3-day challenge is that what you're going to see for the next few days only, this is going to come down on Friday night, you're going to see this 3-day BioPharma member. Okay, so to be a part of the challenge, because we're going to use this tool tomorrow more and have some fun with it, you can just click add this. You're going to get 25 credits, completely for free. It'll give you plenty of room to play with this tool and to go ahead and have some fun with it. Okay, so what I'm going to do is I'm going to go over here and I am going to go to the resume coach. Okay, so Jobs AI is a tool that we built for you to be able to help you use technology to become your competitive advantage in looking for these jobs. So we created a series of tools using AI and data enrichment to help you find, assess, and compete for these jobs. So each one of these little AI bots that you've got, and you'll see on the left, menu bar, are completely optimized for pharma. It knows about the industry, it knows about the companies, it knows about all of these different roles that are out there. In fact, we have a database of 50,000 unique jobs that have been posted in the last year by those 2,000 biopharma companies I was telling you about. And we've trained the AI on all of those job descriptions. So if it turns out that Pfizer is hiring a VP of marketing once again, in our training database, we have the job descriptions of when they were hiring VPs of marketing a year ago. The AI is trained on that. It understands the context. If you ever used AI like ChatGPT or Claude or others, they're fantastic, but you got to give them context. They need to know more about you, more about the situation, more about the industry to optimize its responses. These are optimized, so check them out, try to use them. I can go to the resume coach and I can create a new conversation. So I could go ahead and take the job description that I just pasted from Galapagos. Okay, I'm going to I created a fake resume. This is a completely made up person. I'm going to take that person's resume and I go back over to Jobs AI and I'm going to paste the resume, the CV. And what I'm going to do is I'm going to go ahead and after paste it all in there, I'm going to click Analyze. I'm going to let the AI go do its research to understand more about the candidate and the job. And it's going to give me a bunch of feedback on this. So you'll see it can, there's a lot of information here. It comes down to actionable steps. I want you to do that with a few jobs tonight. Okay, so by the time we meet tomorrow, your assignment is to go to jobs.medicinemarket.com. I want you to look for some jobs that interest you or interested the people that you're coaching, you're guiding, you're mentoring. Just have some fun with it. If you find something neat, I want you to then go over to jobsai.medicinemarket.com. I want you to use your free credits, and I want you to go in and go to the resume coach and put in either a fake resume or your resume, and have it give you some feedback on that situation. You can ask follow-up questions. So I'm going to type in here, what might an interviewer ask me on the first phone screen? Interact with it, ask questions, pretend this is the coach that's hanging out there for you, trying to serve you at all times. So go through this, take a look at these conversations. And by the way, your information is private. Okay, it's secure using our system. People can't look at each other's conversations per se. And if you say, hey, I want to get rid of something, you just go over here on the bar and you can click delete the conversation. So you can delete that chat and it's gone. We don't use this for training information or anything like that. So I think you'll have some fun with that. So a curated way of looking for jobs. So if our network isn't coming alive the way we want it to, if we're not getting calls from recruiters, you can use tools like jobs@medicinemarket.com to help you find curated roles. You're thinking about the process, all right? It's a process of elimination. So how do we best present ourselves? I can't go into this blindly. Let me use tools like Jobs AI to help me figure out what might the applicant tracking system flag? How might I improve my resume to better tell the story and show myself as a fit, knowing that I'm probably going to be competing with 50, 100, 500 applicants, qualified and unqualified for the same job. I've got to find a way to stand out. And these tools are ways to help stand out, but there's so much more that we need to do to put ourselves in the best position possible. And that's why this is a 3-day BioPharma Job Challenge and not a 1-day. So with that, I want to say, if you are having a good time with this, if you could please share this with other people who want to join, that would be great. And let me incentivize you, if you make that investment in sharing this to help our community come together, root for each other, and help put every qualified person in a great opportunity and make every company in a position to have a culture of innovation so we can do great things and fulfill our overall mission, I will invest in you as well. So on the platform that you'll see that there's an announcement that'll be coming up in a minute. I'm giving out one-on-one consultations. I only have a few to give. So it's first come, first serve. And when it's out, it's out. But for today, for attending live, click that link. I'm going to have 3 spots open to folks. I'll give you 30 minutes to talk about your situation. If you want to talk about the industry, your resume, competing, talking about networking with other people, your LinkedIn strategy. If there's people or companies I can introduce you to, or our team can introduce you to, I'll have a few spots of those open. I might have more spots open up tomorrow if you join, but you got to go to 3day.medicinemarket.com to get access to all the tools and the resources. So check out the app. We've got a worksheet for today, which gives you connection to a Google Sheet to help you track jobs and your progress, which is a lot of fun. We've got links to all of the different resources. There's more resources to come. And you're also going to hear about over the next couple days a new AI venture for pharma that I have got a lot of excitement around. It's not available yet. If you want to get in beta access, I'll tell you how to go ahead and do that. But imagine having a tool that doesn't require you to have lots of authorizations and permissions from your company. It doesn't need your company data. But if you have situations where you need help with communicating a vision over the next 90 days, say between POA meetings, say you've got a situation where you're trying to build consensus to put some sort of program through the medical legal review process. You need other help in having clever insights to build a presentation and have something build slides for you. What if all those tools existed in one place? That would be kind of neat to help you. And again, you don't need your company to build the AI, and you don't need access to the company confidential information. You can use something that stands alone to get a lot of these tasks done. That's interesting. I think we've built something like that, and I'll share more about that with you over the next couple of days. Okay, so we are up on time. The one-on-one bookings are available for those that joined us live. Thank you. I'll see you tomorrow, 12 o'clock Eastern, for the next session. We go into advanced tools. Friday's kind of ridiculous. You're going to love it. It's going to be a lot of fun. If it turns out you can't make one of these, don't worry about it. If you're at 3day.medicinemarket.com, you can even watch the replays on the platform along with all of the other goodies. So with that, thank you for sharing your time and treasures with me. It's been a blast. I'm having a great time with it. I can't wait to see you on the platform tomorrow. I'll see everybody.